was intending to not speak again until probably a week or so, but clearly things have actually really taken off from the point of view of coronavirus in Wythenshawe area. Dr. Das and I had a lot of calls from patients who've definitely got coronavirus, and be aware that this is not just affecting the elderly. We're seeing even younger children who are having symptoms, although obviously the long-term effect on them is going to be, well, hopefully there isn't one, so but they're feeling quite unwell and getting high temperature. So I think it's really important that, as the government is saying, you've got to keep children in, because they are, apart from just spreading it, they are clearly suffering from it to some extent. The other one is a little tip for anyone who's looking after the elderly as a care worker. We have to assume, I am certainly assuming, everybody I see now has actually got coronavirus. Now, there's plenty of things that we can do to not spread that coronavirus, and we know about the distancing, we know about social distancing, keeping away from other people as much as you can, but actually, if you're a care worker, you've got to be obviously close to patients sometimes. My little tip on that would be, don't talk. Okay, so I think, little motto we should have is, if you're looking after a person, don't talk. If you don't talk, the coronavirus can't actually really come out of you. Okay, so this is one of the reasons why we use masks, to stop the spray, etc., coming out. But if I'm not talking and I'm breathing through my nose, what's coming through your nose is probably just a vapor. Okay, so if you've got to make the best of the situation, if you're next to a person that you're perhaps turning in the bed or giving them some food, it may seem mean, but don't talk to them at that point, and just let them talk to you. It's, to say, particularly in a care home, because as you were coming into the care home, from what's apparent from what I've seen now, you're not being given PE protective equipment, so you are at risk of, as you talk, then the spray is going to go out, the vapor is going to go out. So when you're getting close to the patient that you're dealing with, obviously, as you come through the door, just tell them that you're not going to talk to them, you're not going to say anything when you're close to them. Okay, I think this will make a massive difference in terms of your infectivity if you've actually got the virus, which of course you don't know until a few days after you've actually contracted it. So that was all today. Really, as I say, it's definitely quite prevalent now in Wythenshawe, and we've got quite a few patients who are not very well. We don't want this to spread. Everybody, please just keep in. They say it's going to be 3 months. The rate this is increasing in our patients, well, who knows, but you've got to stop it now. So say, whatever you're doing, don't go to your neighbours, stay in your house, or obviously in your own garden, but don't be tempted to go next door or anywhere else. At least if you do that for the next month or so, we'll just see where things are up to, but you've got to be strict with yourselves. Obviously a lot of people are doing things correctly. We've seen that, we're not going in shops, we're not close to each other in shops, but this definitely will confound it. As I say, this is what I'm doing. I have no intention of getting coronavirus, and I'm sure if you all abide by this, then it can't travel, can it? It's not magical, as I said before. Yeah,